Hey guys, so this meeting, this lecture we're going to record is on chapter 16. I had to change up the background. I needed something fun, so we are pretending that we're at the beach today. I've got the baby sparrow that we've been taking care of the last 2 weeks. Little nestling fell out of the nest in the storm, and mom didn't come back to the nest, and neighbor found her, and we've been taking care of her. And this is Jack Sparrow. Now we know that Jack is Jackie the sparrow. So let's get started on chapter 16. This is going to be on epidemiology. So I thought it was highly important, specifically what we're going through right now. This totally applies. This whole section applies today. So this video is the first one, epidemiology, where we are trying to figure out, it is where you're trying to discover the geographical distribution and timing of infectious disease, how they get transmitted, and trying to control the outbreak. All of that is epidemiology, trying to figure out what's causing the illness, where's it coming from, what's causing it, how can we stop it, all of that, epidemiology. So we're going to talk about a lot of terms. I pulled some good stuff from the state's Department of Health on COVID that we can use to apply to real life right now. Okay, so case study, it is late November, early December. So Thanksgiving time, past Thanksgiving. We're in Florida, and they have cases of acute gastroenteritis in the ER, vomiting and diarrhea, abdominal pain, cramping, severe dehydration. Yeah, if you've got diarrhea and you're throwing up all day. Okay, so this was a lot of cases at this one hospital. They were concerned because that's not normal. They started calling around, and other hospitals in the area had 10 to 20 cases a day too. So we're looking at an outbreak. What's causing this outbreak? We need to know. So we are going to put on our epidemiology hats and try and figure out throughout this chapter what's making all these people sick. So some terms. We have morbidity, and morbidity is you are sick. You have the state of disease, you are ill. And out of the morbidity, we can have morbidity rate. And that's going to be how many people are sick, how many diseased individuals do you have per some standard number. In this case, it's per 100,000. That's what the textbook uses, and that's what we are using here at the Department of Public Health, Georgia's Department of Public Health. So it's per 100,000 residents, and it's broken down by county in the whole state, so you can see every county in the state. I specifically picked Bartow because that's where our Cartersville campus would have been if we'd have been face-to-face. So I picked Bartow County to see how many cases they have. And there is 265 right now total for a 246 per 100,000 case rate. So if we're using the 100,000 people, their rate is 246 for Bartow County versus, let me just go goof on the website. The link right here is just a picture. It's just a screenshot, so it's not interactive. But if you want to get the interactive version, it's the daily report out of the website that is being calculated twice a day, literally every noon and every, I think, 7 o'clock. Every single day they update these numbers for the state on the website. So this is the daily status report webpage where I'm pulling this from. So Bartow was 246 per 100,000. Where I'm at, Cherokee has a case rate of 141 per 100,000. Let's look at Fulton, where the airport is. Theirs is 227 per 100,000. Albany, down where the outbreak was, holy cow. Terrell County has a case rate of 1,892 cases per 100,000, right? That's insane. So you can check and see how many people are sick per standard number. So that helps you standardize across different areas, different regions. Per 100,000 is this number here that we can standardize across the different counties in the state. So this is morbidity, how many people are sick, Morbidity rate, how many people are sick per some standard number. Prevalence and incidence. Prevalence, how many cases are there currently? How many cases are going on? So this is our prevalence as of today, April 24th. Prevalence of COVID first coming into the States, and we can see the line's going to start around here, and then it's cumulative, so it just keeps going and going. Normally prevalence, they will, once you have cleared the illness, or if you have passed, if people have died that have been sick and they're no longer part of, they will no longer be part of the prevalence numbers. But right now, it's still new, and we can't say who's cleared it and who hasn't, because we don't know officially if that's happened yet. So everything's really just accumulating. It's just accumulation of all the cases. The good news is we can see that the cumulative is starting to taper off, which is great. So let's look at incidence. That's our daily cases. What are the new cases? In this case, we're looking at daily, but we could look at cases per year. How many new cases per year? In the next slide when we go to HIV. But in this case, we're looking at per day. Like literally, we want to know, is our shelter in place working? Is it cutting down on the case numbers of new cases per day? So this is our general curve, and we can see it's coming up, and if we just kind of average the days together, it looks like, you know, shelter in place is finally having an effect, because we are tapering down way down here on our daily case for the incident. So prevalence, cumulative, how many cases do you have? And if it was HIV in the next slide, you know, they're ongoing. It's something that you have for life, unless you've passed or somehow you've cured yourself of HIV. Incidents, how many new cases, the new cases are happening. So here is our number of cases, so our cumulative, and how many new ones are we getting. And we can see we spiked up, and now we're starting to taper off on our daily incidence of cases. So it looks like the curve is flattening. People, it looks like our what we've been working on so hard while we're doing these videos and sheltering in place, it looks like we are starting to see the effects of the shelter in place. When we take this data, and if you are a person who likes numbers like I do, I like to play around with numbers. Statisticians will have a field day with these numbers. So you can take all of these cases, and then if you get the information regarding those cases, was it a male, was it a female? What gender do they identify with? How old are they? All of this is good data that you can analyze and try and figure out who's more susceptible, who is more impacted by this disease. So in this case with COVID, they broke it down by age in this first group. So we got age group here. In our state, the most prevalent age group, 62%, and it's a huge age group, it's a huge category, but we keep hearing that it's all the old people, it's only old people. The biggest category is 18 to 59, and granted 59 is not a spring chicken, but 59 is not ancient either. 18 to 59 years old, 62%. So the majority of cases are under 60 years of age. The other large chunk is older than 60 years of age. So the what we all thought and were told, it's just old people. My mom's age range, I love my mom, don't get me wrong, but she's in her 70s, and I really worry about her because she's in the susceptible population age range, and she's pre-existing conditions. So she is part of this age range, and that's the second most prevalent age range, is in the 60 plus. That pretty much everyone else in the adult age range below that is the 62%. We got 34% in the older group, and then minors, children, are 2%. And then there's, we don't know, that data wasn't collected for those people, for the other 2%. We don't know how old those people were that came in with this. So we can break it down by age group, break it down by gender, by sex. More women than men. Females are 54%. And then you can break it down by race and ethnicity. Who's more impacted As far as race, so we can break it down, race and ethnicity. We have some white and Hispanic, white non-Hispanic, white unknown. And I'm just roughly crunching those numbers in my head, and I'm looking at like 5K out of those all together. Let's look at Black Hispanic, Black non-Hispanic, Black unknown, and let's add those together. And number of cases looks roughly like 6, 7, I don't know, 7.2 thousand. So it looks like, as far as race and ethnicity, I can say it, certain segments of the population are more impacted by this disease. Well, why is that? Let's look into that. And that's, you know, a whole lecture for another day on why minority populations are more susceptible and going to see the more incidences of certain diseases. There's a whole reason, lots of them, for that. But I won't go into that because that's not what I'm going to talk about today. But there's a reason, and it's not good. Society reasons. Anyway, we're sticking with the science. We're going to stick with science. So confirmed cases, you can analyze that stuff. Age, sex, race and ethnicity, crunch the numbers, and that information is valuable. It's valuable stuff. Then you can figure out which populations are being impacted and try and help those more than, say, somebody else, another group of people that aren't being impacted as much. You can put your resources to the people who need it. So if we were looking at HIV and not COVID, we're going to switch over to what the textbook was talking about. And the textbook mentioned HIV. So their total number of active, so everyone who's got HIV and has not passed, they still have it, is in red. So we can see, you know, it's cumulative, it's going to climb, and it continues to go up. The new ones are in blue, and you could see, you know, before we knew a whole lot about it, that numbers were going up and up and up. And then once we finally did our epidemiology, what's causing this? What is it? How is it spread? Who's impacted? Then we can learn about this, educate others, and hopefully that rate of incidence, the daily cases, or in this case, the yearly cases, drops down. I hate to see it drops down. So we can see that the blue line is way down here. Thank goodness for that. So number of new cases is not continuing to go up. It has dropped and it stays at a base level, which is great news for this disease. So prevalence is the accumulation of everybody that has this disease. Do they still have it? If they still have it, they are in prevalence. Incidence is how many new cases keep happening. So know the difference between prevalence and incidence. And another bit of data out of this is the mortality rate, and that's the one that everyone's talking about, and it's terrible. So we want to know, how deadly is a disease? What is the mortality rate? How many people are passing away due to this illness? And normally you put them at number of cases per 100,000, just like we looked at before. So this is our cumulative in this graph. Here's our cumulative graph. So of course they're going to accumulate and the numbers are going to get higher and higher, but it looks like starting to taper off closer. So hopefully we can, I know it's a cumulative, but it'll plateau. Hopefully if we don't get any more new cases, it should plateau instead of continuing to climb. Mortality rate. So here we go. We were talking about hopefully it's going to plateau out. So we started, here we have the first case ID'd in Georgia, February 29th. And then it's really, really low and it starts to climb. Here's our gathering ban when we started to restrict no more than 6, no more than 10. You can't have groups of 10 or more people. That was our gathering ban when we put that in place, and here was our level of mortality rate. Then when we put in our shelter in place that we're coming out of officially sort of in phases today, our shelter in place, here was the mortality rate. So higher when we had finally implemented shelter in place. Death toll continued to spike, and now it is finally coming down a little bit. Everything in gray here is a little sketchy because if it's super recent in somebody's past, we still need to figure out was it really COVID or was it something else? And so we need to perform an autopsy and you got to wait for those results. So everything in gray is still a little in the air. But in general, it looks like, we spiked and our preventative measures of banning large groups and staying in place seems to be working as of now, as of April 24th. This is looking, mortality rates are never something that you want to be happy about, but it looks like they're tapering off. Okay, so patterns of incidence is another part of this section in the chapter. So how do we classify these things? Are they showing up every once in a while? Is this a giant global pandemic? How do we classify this kind of disease? So if it's showing up every once in a while in random places, it's not just located in, Hawaii. It's all over the place in random, sporadic. It's not all at once. It's literally just popping up randomly. That would be a sporadic disease, and an example of that is Clostridium tetani. Tetanus is something, again, that you can't pass person to person. Remember, you have to pick that up, and you get infected with the endospores because you stepped on a nail or whatever happened. So this is not person-person transfer. This is sporadic disease. What about a disease that is showing up in low levels and it's like always there in the background, but it's limited to a particular region, like the tropics? Oh, excuse me. That would be endemic. Endemic disease. So an example of an endemic disease, say located in the tropics, is malaria, because the mosquitoes are loving that area. If we were actually wherever this film was taken, in the background, you may have to worry about malaria. It is endemic, means it's usually found in a general geographic region. Epidemic. Epidemics are going to be in a geographic region, but they will have a higher number than normal. So with epidemics, an example of epidemics is the flu. And so we have examples of ER visits with flu-like symptoms. And we can see flu usually picks up in the Northern Hemisphere in the wintertime, right? We usually get our flu shot in like September, October. So hopefully that prevents flu that picks up about that time and runs all the way until like February, March. It's normal flu season, so it's usually over the winter. And what's our normal baseline for flu occurring? How many incidents do we normally get on average per year? And then keep track of what are we getting this year. So in 2006 and 07, that winter is in the blue line. 08 and 09, that winter is in the red. And 07, 08 is also spiking up there. I can't remember. I think 05 was bird flu. And I think 09 might have been swine flu. 07, 08, I think that may have just been another novel version of flu, another possible antigenic drift version that we normally don't see. So if, again, we talk about antigenic shift and antigenic drift and how it can change just a little bit or it can change a whole lot. And normally if it changes a whole lot, we're not quite prepared for it. Our immune system isn't ready, and you're going to see more cases of that showing up. So we have spikes, and these spikes would be considered epidemic because they are higher than normal. But here's our national baseline, and we're spiked way up here. This is an epidemic level. It's higher than normal. Let's look at it on this picture too. We can see deaths due to flu and pneumonia, and baseline is in black. Epidemic threshold, anything above that, we would call it an epidemic. So mortality rates, here we are, it looks like 03, 04, and mortality rates are way up here. So we would consider that an epidemic level in 03, 04. Then 05, we're spiking up again. So that could be an epidemic. We're down below for 06 and 07 is pretty low. 08 spikes back up, another epidemic of flu-like deaths. So if you're above, again, above baseline, above normal, there's an epidemic threshold, and once you're over that, it's considered an epidemic. So it's in a general region, but you're above the normal numbers for that general region. Pandemic is not limited to a general region. It is literally worldwide. It is a global illness, and that is exactly what we're in right now with COVID-19. Other global illnesses, HIV and AIDS is worldwide. It is spread worldwide. The flu goes worldwide. Avian flu, swine flu, that spread worldwide. And of course, COVID has spread worldwide. So if it is going worldwide, it is a pandemic, and that is what we are in right now. Okay, so let's check and see about all the people that are sick with food poisoning, probably with their gastro symptoms. So some type of food poisoning. Sudden post-Thanksgiving outbreak. And in 2 weeks, they saw 254 cases. And then by the end of December, the end of the first week of December, it ceased. So it was a very brief time frame with a huge spike. So we're having an epidemic of food poisoning. What is the cause of the food poisoning? So they're thinking, since it's local, again, it's in one area, everybody is going to hand over the records, and they're going to start testing stool samples. And once they tested everybody's poo and figured out that salmonella is in all of these sick people's stool. All of the patients' age range 3 to seniors, males and females. So all age ranges, all males and females. 3 deaths, severe dehydration. They had pre-existing conditions, and basically they waited too late. They tried to tough it out, and it didn't work out for them, and they died of dehydration. Secondary to the symptoms, to the vomiting and the diarrhea. So we know that these people got foodborne illness of salmonella. Well, where did they pick up the salmonella? That's my next question. Where did they get this stuff from? How did they all get the same illness? Certain diseases are going to be notifiable diseases. The CDC, who keeps track of this stuff, wants to be notified when cases of certain things pop up. So Campylobacter, Giardia, gonorrhea, we keep track of all of this. How many cases are you seeing? Are we seeing an epidemic level of these numbers? Is something going on? Is there an outbreak? So if it's a reportable disease or notifiable disease, HIV, West Nile, COVID, CDC is keeping track of this. So you have to report to the state reports it to CDC. We keep track of all of this and try and make sure that everything's going okay. And if it's not going okay, how can we mitigate what's going on? So every week they publish their MMWRs, morbidity mortality reports that will go out, and you can see what it is that's impacting. At least if you're a physician and in the healthcare field, you can see what's impacting people for that week for notifiable diseases. It's always out there. So that finishes up this first section of chapter 16. I know I'm going to feed you. Just hold on.